high level, just covering a few key steps and a little bit of the philosophy in terms of program evaluation. Of course, there's books, courses, and degrees on this topic matter. So we're really just going to touch the surface of the topic matter for today. And as was mentioned, some version of this presentation will be made available to you as well. So just a quick introduction before we get into the topic matter of who we are. Our unit is the Monitoring, Evaluation, and Knowledge Transfer Unit, and the name is very literal because we do all of what I just listed: monitoring, evaluation, and knowledge transfer. So monitoring of projects to see how things are going, evaluation of programs, and sharing the knowledge broadly. And the link is there and available to you to take a look at what we do. So our unit actually came to life as a unit because of the Healthy Seniors Pilot Project, which is a $75 million agreement investment partnership between the Public Health Agency of Canada and the government of New Brunswick. And Healthy Seniors Pilot Project, or HSPP as we've been calling it, is a portfolio focused on seniors programming. So we know New Brunswick is an aging province with the median age estimated to rise. And HSPP evaluation work is very timely because it focuses on this healthy aging. So within this funding, project teams from across the province create and implement healthy aging programs, anything from art and creative programs to boost happiness and socialization, exercise programs, boosting wellness, and learning how to use apps to improve mental health as well. And this website that I have on the screen will also give you a list of the portfolio of these projects. Our unit is a key piece in this. We employ evaluators, a KT officer, research assistants, a program manager, and a director. And one of the jobs we have is to help support the ongoing HSPP evaluations and help them be as strong as possible. So we help operationalize questions like, did it work? How is it working? How do we measure if the program is causing change? And we also help report the findings to government on a regular basis. Our unit has expertise in education, environmental studies, gerontology, psychology, just to name a few. So we have a very diverse social sciences background. Healthy Seniors Pilot Project is not all that we do. If you've ever tried to look for support in evaluation in the province, you might think, I could use some support. The province needs this kind of support. Our unit has also branched out to offer contracting and consulting services like our affiliated MBIRDT unit. So we do lots of applied research with local clients. So just before I get into this question today, I will just briefly introduce myself. As Eva mentioned, I'm a research scientist in the unit. My background is experimental psychology, and I do have a passion for all things social sciences and social justice, as was mentioned. I came to evaluation through academia and the university. So all of what I say is kind of colored or tinged with the academic, the university, the applied research experience. And I do recognize that people come to evaluation from a lot of different backgrounds: business, government, backgrounds like Lean Six Sigma. So it's a very diverse field. So I wanted to set you up in terms of understanding where I'm coming from today. And as well, just a brief comment on the plan for today. I will cover some definitions, how to plan an evaluation, very high level, and some helpful hints and tips for you to bring with you, and really just try to inspire working in evaluation, regardless of your experience in terms of this topic matter. So the question I have on the screen is, why do we want to talk about evaluation? And there's probably a lot of answers to this, and each of you are coming with your own motivation. But one reason could be that we live in a world of data and accountability, and we want to track or account for something or show that something has had an impact in some way. You've probably also noticed there are a lot of opinions in the world, how things work, how they ought to work, theories about why people do the things they do. So in the evaluation world I'm going to introduce you to or talk about today, we're interested in more than just opinions. We want to explore things systematically and with some degree of rigor, and then make claims about their effectiveness and their value. A lot of people point out that the word value is written into evaluations. So we are making these type of judgments. I will also say that evaluators are pattern finders. We look for patterns among people, and we want to predict with some degree of accuracy what people are going to do or get out of a program. So it's probably a lofty goal to be able to predict the future, but as evaluators using applied research, we can estimate with some degree of probability the likelihood that something will happen or not. So people getting better, improving, becoming more knowledgeable, or becoming happier, all the good stuff that you're hoping that your programs are going to do. So although I can't predict the future as an evaluator and researcher, I can help with some degree of competence understand how the world works and how people are going to react to the program. So program evaluation is one of those knowledge disciplines that makes sense of data, tracks changes, tracks numbers, and gives you the tools to do so rigorously. So just by way of introduction, we probably all have a sense of our own programs or what we are thinking about when we think about program evaluation. But I just wanted to start with just a general definition. A program impacts people. They cause a change in some people, so changing behavior, improving lives, educating. All of these things are why you would attend a program to begin with. So there are things like a list of programs that I have on the screen here: after school programs, exercise programs, childcare programs, weight loss, seniors club, school lunch, healthy mothers are all different programs that add value to our lives, and they're supposed to help us change in some way. So what evaluation is going to do is answer the question, how do you know your program is working? And the component parts are working and it's reaching the intended outcomes. So the questions there in the speech bubble that I have on the slide. I do also want to make a side note here that policies can and have been evaluated as well with some of the lenses that I talked about today, or I will talk about today. So policy is a law, regulation, procedure, action that is meant to change behavior in some way. And when we think about it, we were all part of a massive behavioral change experiment, if you will, our policies due to COVID-19. So things like in the hospital, wearing masks, things like quarantining. So policies can vary in their complexity and they can vary in their reach, but you can evaluate policy as well. We'll be focusing on the program evaluation bits today. So let's get into a little deeper about program evaluation. I just put up a textbook definition of what program evaluation is, which is the systematic collection and assessment of information about activities or outcomes of a program, service, policy, or process in order to make a judgment about those things and improve effectiveness and inform decision making. So I just want to unpack this a little. Evaluation gives you the tools to figure out how something is working, if it's working, who it's working for, and what can be adjusted. And as I mentioned a few slides ago, one of the operative words here is value. Think about all the programs I described. Why would you participate in a program in the first place? Probably because it adds value to your lives in some way. Maybe there's social value, psychological value. Evaluators also work in this field. We are making value judgments on these programs, and we can say things about the psychological impact and even the monetary value, or if these programs are cost effective and cost efficient, and make judgments that way. So sometimes we're literally putting a value on these programs. Often we are. So saying things like, this has been 50% effective, or the vaccine is 90% effective. We're making these kind of judgments. The other operative word that I wanted to point out today is the word systematic. So you probably can imagine a scenario. Let's say you're running a program like a stop smoking program or a smoking cessation program, and somebody asks you, does it work? A member of your team might say, it seems to work, or my friend says it works, or we use it, so it works. All of these statements are things that would make an evaluator pause because they're anecdotal and kind of based on opinion. They're not systematic or systematically collected. Some of what I said just relies on hindsight bias. So you convince yourself something is good after the event, you look back on it in hindsight, or confirmation bias, only asking people who have something good to say or only finding the data that supports your program. So these are all things that we kind of want to get away from as evaluators. We want to do things in an unbiased way using a systematic approach that generally involves applied research practices. And when we use this is how you know you can trust statements like the one that I have on the screen. So if you're scrolling through the news and you're starting to pull out data, we want it to be done in a systematic way so we know that we can trust it. So this is the core of what I'm going to talk about today. They're very simplified steps in evaluation. So I'll just briefly go over them. The first step is really important, but it's actually not totally evaluative. It simply involves describing and defining your program, often using a logic model or some other basic documentation. I'll talk about a logic model today. You've probably heard of documents like theory of change or other things that go into program evaluation. These can happen around step 1. Step 2 is choosing your evaluation type and figuring out what you want out of your evaluation, the type of questions that you're going to pull, what is really important for you to know about this evaluation. Step 3, identifying suitable methods and indicators to conduct the evaluation. And finally, collecting, summarizing data, and sharing the results back. So people who are coming from a research background, a lot of this is going to sound familiar to you with a few different tweaks and different steps involved. So let's start with just step 1, which is the logic model and the role of the logic model. So most people in this field would agree that an early step is to draft a logic model. And a lot of people would say that it's really important to include key stakeholders and different perspectives when you're drafting a logic model. So it's not advised to sit in your office and do a logic model alone. It's really helpful to make it participatory and bring people into the planning and the session when you're putting it together. The logic model is a core of programming and program evaluation, and I've often used the metaphor of an elevator pitch. So it's kind of an elevator pitch of your program. It tells you what the program is and the activities, as well as what's going to be produced in terms of outcomes. And some of the benefits are listed on the slide in terms of a logic model. So it acts as a roadmap for planning, so you can help shape program strategies, clarify processes, what you're actually going to do in your program, and illustrate the program to stakeholders in kind of a very simple, logical way. It presents a logic, so when you put this together, you can help identify gaps in your program. If you have outcomes that don't seem quite right or they don't follow logically, you really take a step back and think, okay, I really have to rework or rethink some of what I'm doing here. And it can help point out who's doing what as well in terms of program, running the program. It's a communication tool, and you'll see one momentarily. And if your logic model isn't logical, your program really won't meet the desired outcome. So all the effort you put into it, if it's not clicking, if it's not logically working together, you probably won't see the change that you want to see in terms of your program. So this is a basic structure of a logic model, very, very high level, very oversimplified. The next slide will actually show you a mock logic model of a potential program. And I've kind of broken it down into a couple of different sections, characterized by those red brackets at the top. So the first four columns are really what your program is made of. What is it doing? And then the last four columns are really the outcomes. So what is it going to achieve, or what are the intentions? Often this one is viewed as a series of if-then statements. So if you have certain inputs, these lead to activities. If you have certain activities, these lead to particular outputs. I do want to have just a word of caution here. There are many different versions of a logic model floating around. Some have different labels on top. Some might drop a column or kind of combine a few. But the basic gist is to define your program. And it's really important to find one that works for you. So this is one that we would be using for kind of a Healthy Seniors pilot project to characterize some of the outcomes as well as the system level impacts. So just very briefly, I'm going to walk through and then I'll put a specific logic model in on the next slide. Objectives are fairly straightforward, what the project attempts to achieve in a specific, measurable, time-bound manner. So some specific action statement, like we're going to implement a mental health training program. Inputs are the resources, the means of the program, the resources dedicated to the program. So this can include human resources, money, physical locations, staff, volunteers, who's going to help run the activities, and funding as well. The activities are what happens within the program. So what are your participants actually going to be doing? And these can be a vast variety of activities. If you're thinking about putting in programs for training, you could have different modules. You can get participants to do different activities. I've seen logic models that characterize art programs, exercise programs. These are all the specific activities that the participants are going to do that help promote change in some way. Following this is the output column. So what are the immediate quantifiable products? What is the evidence that your activities happened? These often appear indicator-like, so you'll write down things like number of modules, number of people trained, and it's just evidence that you've run your activities and you're demonstrating that they've happened. So those are the first four columns. And the last four are probably things that people jump to first when they're thinking about a logic model in terms of the outcomes. How do people change? And that's exactly what these are trying to characterize, is how do my participants or whoever is involved in the program change in some way? So in the short term, this column is a little bit relative, but it usually captures what the change in the participants are in a few months after the program. And usually these short-term outcomes are learning-based. So participants have learned something new, some new exercise or some new wellness technique. We usually need to learn something before we make behavioral changes. The second one is the medium-term outcomes. So what is anticipated to change in the next year or so after the program? Again, these are more behavioral changes. So you might start exercising more, eating healthy, or however the program prompted you to change your behavior. Longer term outcomes are a little bit more loftier. Once you make behavioral changes over your life, you can see yourself getting healthier, see your participants getting healthier. And we often, in the Healthy Seniors pilot project, we have some system level outcomes that we try to track. So things like if hospitalization, or things in larger systems that operate in the world. So if you're healthier, maybe you will reduce your use of the emergency room or something along those lines. There's also assumptions and external factors. These are things sometimes you might not even be able to control, especially with external factors, but it's worth just having it down on paper. So beliefs about how your program will work and the conditions believed necessary for success, and external factors are really factors beyond the program that might influence implementation, operation, or outcomes. A very good example in the past 3 years has been COVID. So this is an example of this logic model filled in. This is a very simple mental health training program, a topic of perennial interest. So maybe you notice that there are mental health issues among youth and you feel that education is important and that you want to implement a mental health training program. Starting reading this from left to right, the objective would be to implement the mental health training program for youth to improve wellness. The inputs are staff, schools, budgets, teachers, facilities, and all the material as well. Funding is there. The next column is activities. So perhaps you're doing some module-based learning, some intervention, difficult conversation practice around mental health training. Really, the sky's the limit for some of these activities, as long as they're tied to strong theory that they'll promote change. The outputs, you have about 100 youth participants, 10 schools, the number of modules. These read very indicator-like. Youth are more knowledgeable about the causes and treatment of mental health. They're able to change their behaviors, apply mental health solutions in day-to-day life, and in the longer term, they're able to improve their own health and mental health or the health of others. And the system level taps into really maybe there's some hospital level indicators that change because of your mental health training program. The assumptions are at the bottom. Youth are accessible and interested in the program, and it's based on sound theory. And external factors I've already mentioned. Maybe there's some political changes or protocols are changing in terms of your ability to run this program. So before I move on, I want you to notice a few things about this logic model. It's very simple. It's an elevator pitch of what's going on. You'll notice also what it isn't. So it isn't a work plan. It's not a Gantt chart. It doesn't say much about the evaluation yet. It's just kind of this overarching pitch of what the program is going to do. And another point to just consider here is, do the outcomes make sense? And this is where a logic model is really helpful, I think, in operationalizing your program. Is there something hanging out in the outcomes that your program isn't going to do? So imagine if I put something in there like an outcome about teens reducing smoking. That's not really a part of the program. So I don't know why it would be in there. I know that it's tempting to find some other outcomes to show. Or it might be a stretch to say maybe parents reduce their own mental illness, but maybe that's not really a part of the program at all. So the point of this is that we really want it to be realistic. We want a realistic understanding of the program, and we don't want to get too lofty. So it's just good to have your program on paper and recognize what it is and what it isn't. So that was step one. We've drafted a logic model. Step two is really choosing the evaluation type and the evaluation questions. Before I get into this, I do want to say that something else that a program logic model doesn't tell you is if your program is actually going to work. The outcomes are just hypotheses. So they're proposed, but they're not really guarantees. Something that is also very helpful kind of in between these intervening steps is to draft something like a theory of change. So you can come up with how change is going to happen in your program. It involves a lot of boxes and arrows kind of pointing the way to how youth will change. The stronger the theories that you have, the more likely that you're going to see change happen, or maybe there's a little bit more strength and confidence to show you that your program is actually going to do the things it's intended to do. So for this, moving on to step two, for this next step, we want to start to focus on the evaluation. We're actually getting into the evaluation. What do you want to know about the program? So we're going to start thinking evaluatively. Do you want to know how things are going overall? Or do you want to, and the impact and the overall impact of the participants? Do you want to know how the nuts and bolts of the program are working? There's kind of two different lenses here that I'm going to characterize as process evaluation or outcome evaluation. And this step is really important because it kind of drives the evaluation design, questions, data collection, gathering of information, the who, what, where, when, and how of what you're going to do with this. So just to characterize the process evaluation, this is really interested in how is this program operating. To use a metaphor here, I'd say the nuts and bolts of the program. So those pieces that are kind of holding it together and moving the gears. So if you're interested in knowing things like how well the program is working, the fidelity, is it implemented as designed, are the target groups involved, or really answering the question on the screen, is the mental health training program, the one that I just showed you, being applied consistently at all sites, you're probably going to be doing a process evaluation. So it's really how's it going on the ground as the program is being implemented. Some of the questions that a process evaluation answers would be things like, when did your activities take place? Who's being reached? Who's the target audience, and is it being reached effectively? So we'll pause here for a moment and say that a process evaluation might not be as kind of attention grabbing or flashy as an outcome evaluation, but it's actually quite important. It's often done when the program is in its infancy stage, it's kind of young and it's getting going. And one of the things that a process evaluation does is help avoid what we've called the black box program. So something that's been associated with programming is that sometimes programs seem like a black box. You have some inputs that go into a program, things happen, you're not really keeping track of it, and then we have some outcomes at the end. Without a process evaluation, you won't actually know how all of the pieces are moving together. So I would say this is why it is quite important to consider a process evaluation, especially if your program is quite young. The other one that I have on the screen is an outcome evaluation. This is probably things that we're more familiar with, I guess, especially if you are in a traditional applied research realm. You want to know what was the overall impact at the end. So in this case, it assesses the program's impact on the target population after they've engaged with the program. So examining the results, the outcomes. When you read things like 50% of people quit smoking or 75% of people increased healthy eating, those are probably good indicators of an outcome evaluation of how the how the program changed participants. So one example on the slide in the little speech bubble is, did participants reduce symptoms of depression and increase happiness after participating in a mental health program? So that might be done kind of or assessed after these participants have been going through the program. The benefits of the outcome evaluation sort of go without saying. So it tells you overall how it works. I will also have a word of caution here that outcome evaluations can be quite complicated in their design. They're arguably at times a little bit more complicated than process data if you're trying to get some causal relationship for what you're assessing. So it takes a lot of thought and a lot of research and some reading into applied research methods in order to do some of these outcome evaluations. So we're moving right along to step 3 to identify methods and indicators. So you've decided on what type of evaluation you're going to do. A lot of the examples for the latter part of this talk will be about the outcome evaluation. And the challenge here, of course, is how do we measure this? What are we going to do to show that change has happened and that we can write this in a report? So indicators are these measurable pieces of information that give you evidence of your outcomes. And it's really important to choose your measurement wisely. It should have a relationship between what you're asking, so your valuation questions related to your outcomes or your processes, and what you're measuring. This should have a logical flow. And I'm going to use an example here to kind of illustrate that. Again, in the speech bubble, maybe we want to show that this program that we're implementing will improve students and youth happiness, but it gives you pause to figure out, how are we going to actually measure that? That doesn't advertise itself as a clear, happiness doesn't advertise itself as a clearly measurable thing. Often we're working in abstract concepts, constructs, ideas. So we have to get very literal and very creative when we're identifying indicators and methods, which kind of tie together. So I'm just going to give a few examples of the types of indicators in a very oversimplified way. Again, this can get very complicated very quickly. So usually our go-to, or what people think about first, are the quantitative or numerical indicators. And this is probably no surprise. The world turns on numbers. So if you think about all the numbers you've encountered through the week, number of hours worked, steps taken, calories burned, clicks on a website, likes you received on a post that you made about your vacation, these are all numerical indicators. And to use COVID as an example, again, we are very consumed with numbers in terms of numbers of cases and numbers of vaccines, and they all had meaning to us. So this is probably no surprise that one of our go-tos are the numerical indicators. These can be collected via administrative data, like the administrative data sets that our MBIRDT holds, index ratio scores, percentages, standardized testing. And let's just bring back the example that I'm using about happiness. So we want some quantitative numerical indicator about happiness. It's actually kind of easy to think about a few ways that we can measure this quantitatively. We can look at things like percentage of people who report they're happy, percentage of people who report they are satisfied with life, which I believe is something that Stats Canada has used in the past. Percentage of people who are less depressed or agree or strongly disagree with the statement, "I'm a happy person." I think one of the common themes of what I just talked about is that they're all pretty smart indicators. So this is kind of the watchword for this section, as you want to start choosing measures that are specific, measurable, achievable, relevant, and time-bound. So I think those percentages that I gave you are very specific. You can measure them on Likert scale scores. They seem to be achievable. Whether they're relevant, I feel they're probably relevant, but that might be a good debate to have with your team to really dig down and say, are my indicators relevant to what I'm doing? And also time bound. So you can ask, in the past few months, how have you felt in terms of your mood? There's lots of different types of indicators, and you can get into a great debate about how you want to use these indicators to measure your outcomes. Again, another word of caution, you can probably measure anything. If you go back to the logic model, you could probably measure whatever you want from the logic model. But the question that I would consistently ask is it meaningful? Is it meaningful for me to be measuring happiness in this way? It requires thinking deeply about your outcomes and trying to tie them to the most meaningful indicator, and not just collecting every type of number that you can. The other type of indicator, and anybody who's in the qualitative field will know that this is a very large wash of this subsection of the field, but there's a non-numerical version of indicators. And this field looks a little bit different. I think traditionalists would say that they wouldn't love the word indicator necessarily. The SMART indicators that I talked about on the last slide, that would be up for debate for some of the more traditional qualitative researchers. But just in a very oversimplified way, a qualitative indicator is non-numerical. And qualitative research really comes from a different theory of meaning and knowledge that's often storytelling and it's often subjective. So if I've asked you what makes you happy, you're probably going to tell me a story about travel, family, all these different things that make you happy. You might spend a lot of time describing it. And that's really what the bottom part of the slide is getting at. It's collected via focus groups, interviews, observations, open-ended survey boxes, and we collected over a number of people to generate these large themes. So maybe with our intervention program that we talked about, the mental health training program, we're going to find themes of stigma that reduce healthcare seeking and things like that. So it requires quite a deep dive into topic matter. It requires also a different lens of thinking about knowledge as well. Evaluators, as a tip on the slide, evaluators find rich outcomes when they measure both quantitative and qualitative indicators, so doing a kind of mixed methods approach. I just have a few examples kind of side by side on the screen, maybe to get you thinking about what you want to measure and what you're going to glean from it. So a measurement of access to mental health care, the qualitative, this would be a quote from someone saying, well, you see, I think there's stigma. No one wants to go in and say they have a mental health problem. You worry about what people think. And over a number of interviews and sessions, you'll find a theme of perhaps stigma in health seeking. This can be supplemented by different types of quantitative indicators, number of emergency hospitalizations, sick days due to mental health, prescriptions, and you have those proxies for seeking mental health care, which also do require making some leaps in terms of interpretation as well. So the last step that I'm going to talk about is step 4, the design and execution of the evaluation. And like everything else I talked about in this particular Lunch and Learn, this topic matter fills textbooks. You can get degrees in various types of experimental design or quasi-experimental design and execution of the evaluation. So really step 4 is, how are you going to collect the data? How are you going to collect all those indicators that I talked about and summarize and make sense of it? So most of the rigorous evaluations designs that we use draw heavily from applied research and the scientific literature. One of the very common ways of doing a design or collecting data is something called pre-post. So taking some measurement before and after a participant engages with the program. So take their happiness score before they enter the program and after, and see if that changed at all. Another very common design is the use of a control group. So a group that does not engage with the program, sometimes called in the healthcare field treatment as usual group. This group is the counterfactual, so it tells you what happens when people don't engage with the program compared to when people do engage with the program. Both of these require a lot of thought and a lot of design up front. They can't be implemented after the program has run and is over. So I highly recommend consulting with subject matter experts when you're designing and executing an evaluation. And a few notes of caution. Again, if you're in the research world, this will speak to you. Data collection can be time consuming, and outcome measures often rely on willing and available participants. And data interpretation can vary really from very basic, the percentages that I just showed you, to very complex statistical modeling. So it's really important to think about what you want to get out of your evaluation and what you want to show from your program, and really tie it to these different steps of the evaluation. So those are my 4 steps that I wanted to talk about today. I just have a few tips in terms of evaluation. I think I mentioned this first tip just in the previous slide. Timing is very important. Most people in the field would say that it's important to plan your evaluation as you're planning your program and not try to retrofit evaluation after you had the program running. It depends, of course, on how long the program's been running and things like that, but it's always helpful for cycles of programs to have the evaluation planned simultaneously. One of the things that is also helpful to think about is trying not to get too overly ambitious, especially with your first evaluation. Often your first evaluation might humble you. We don't always find the perfect results or everything working out as perfectly as we like. This is the kind of messiness that is the research world. So it's important to put things into perspective and realize how much you can measure within a given period. One of the other tips I would say would be embrace the minutia of design. If you work with an evaluator or researcher, we get very literal and very detailed about how design works, number of participants, the timing of surveys, and it's really meant to strengthen everything that you do in terms of your evaluation. Sometimes programs that don't work teach us as much as programs that do work, especially working through the process evaluation and figuring out what's working and what's not. We can learn a lot from things that don't quite work out the way that we think they will and make our program stronger so it will work out in the future. And the last tip, I would say your evaluation involves people. Stakeholders really make this participatory. As I mentioned earlier in the slideshow, it's really helpful to sit down with stakeholders who are going to engage with your program. So for my youth mental health, I might ask youth what they want to see in a program, how they want to interact with it, and what speaks with them. Nobody wants to run a program that's a bit out of touch with some of their participants. And also, the program participants are a likely source of data for you. They are usually voluntary. It's really helpful to have keen and eager participants. And one of the things we often do at the university is when we have results, we share back with participants what the results of the evaluation showed. It's kind of a respectful way to engage participants right up until the end. So really just a few conclusions here. If you want to build a strong evidence base, program evaluation is key. The benefits include reduction of bias, potentially identifying causal links depending on how you're going to run an evaluation, figuring economic and social value of a program, and the planning steps help operationalize how you will do the evaluation. So I think that was all for me. My contact information is on the slide there, as well as our unit's contact information.